My name is Mike, and today I'm going to be giving you a tutorial on how to properly do wound care, and particularly wound packing, to a surgical site incision that requires packing. Now let me first emphasize the fact that as nurses we need orders anytime we are going to do a dressing change that includes packing. So in this case we're going to verify the orders, the MD orders, assume that our surgical site patient has already, the wound has been measured, it's been documented, and now we're going to heal the wound from the inside out with packing material. So the first step is to get on the computer, or if you're still on paper charting, use paper charting, and we're going to verify the MD's orders for the wound care and how often the wound care should be. Okay, so this site is on the right lateral side of the thigh. It's about a 6-inch incision and it's about 2 centimeters deep. It requires twice-a-day packing with saline gauze. Saline and gauze is what the doctors ordered. So what we're going to do today is facilitate that wound care for our shift, and we'll endorse the second wound care to the night nurse. So the first thing we're going to do is go introduce ourselves to the patient, tell them what we're going to do, and then we'll go get some supplies and come back into the room. So let me go introduce myself to the patient. First thing you want to do anytime you come into a room is make sure you sanitize your hands. Okay, here's our patient right here. His name is Boney Butts. How you doing today, Mr. Boney? Are you feeling okay? Are you feeling kind of thin? Good. We're going to do your dressing change now, okay? So I'm going to give you some pre-medications. Sometimes it's essential to pre-medicate our patients because the wound care can be quite painful. Usually there's an order for it. If not, we can ask the medical doctor if there's an order. If not, we can get one written before. So in this case, the patient has an order for pre-meds. So we'll assume we pre-medicated the patient. And now we're going to come in and do the wound care. Mr. Boney, we're going to go get all the supplies to do the wound care, okay? And then we'll get that dressing changed. Alright, I'll be back. So then we come back, come over here so we can gather all of our supplies. Make sure you hand hygiene out. Okay, come over here, Bert. Okay. So as you can see, I pre-gathered some of the supplies that we're going to be needing. I have gloves, I have some gauze, I have some 4x4 gauze and some 2x2 gauze. I also have net underwear in case I needed to put that over the wound if I wasn't able to apply tape. Chuck's pads, saline, measuring tape if we wanted to see if there was any new wound changes, cotton tip applicators, a marking pen if we needed to mark the wound if the wound changed at all, whether it was getting bigger or if there was increased redness, we'd want to mark the area. And we also have some Metapore tape. Okay, after we have all of our supplies, we'll take them into the patient's room. Okay, Mr. Boney, I'm just going to put these right here on the edge of the bed, and I'm just going to go wash my hands real quick, okay? Thank you. So we're going to come back over here to we'll assume this is the patient's restroom. And we're going to wash our hands for at least 20 seconds, okay? Give yourself a good hand washing, get a good lather. That's the best. Washing your hands is the best type of infection control that we have within the hospital. It's cheap and it's very effective. Okay? I have another patient calling me from another room. 1 second. Yes, Mr. Jackson? Mm-hmm. You need a bed bath? Okay, I'm going to send the CNA to do that, okay? Yes, sir. We'll definitely take care of it, sir. Okay, bye-bye. That was Mr. Jackson. Apparently he wants a bed bath. We're going to send our CNA to do that because as registered nurses, that's within our capacity to defer. Okay? After our hands are washed and dried, we'll go back into the room to perform our wound care. Okay? Mr. Boney, we're going to do your wound care now, okay? I'm going to shut the door so we have absolute privacy. Okay, Mr. Boney, how are you feeling right now? Are you in any pain? Do you feel nauseous? Do you feel okay? Okay, so we want to get a quick assessment of our patient and how he's feeling before the wound care so we could rate how he did before and how he did after to make sure he tolerated the procedure. Okay? Okay, Mr. Boney, I'm going to go ahead and start to get set up, okay? Okay, so the first thing we want to do is don our gloves. My hands might still be a little bit wet, so we'll wait till they dry just a tad. But as that's drying, we'll kind of get some of this stuff situated here and pre-set up. Note, when you go to do your wound care, you want to document how the wound looks as well. You want to talk about the edges, you want to talk about the appearance, whether it's pink, it's moist, it looks like it's healing, it's approximated, how deep it is. You want to document everything about the wound so that people succeeding you or preceding you know exactly what's going on with that wound. So we're going to get our gloves on. I found that it's actually pretty good to put on 2 pairs so you can, when your hands get soiled, you have a fresh pair right underneath. And usually I use a different size, but I did not get I got the same size here, so we'll see if these work. Keep in mind, it always helps to save your back some lumbar strain or just strain in general to always have the bed at your most comfortablest height. Since I can't adjust my son's bed here where Mr. Boney's laying in, then I am gonna sit down. But typically I would not be sitting down when I do any wound care, but for this scenario that's what's gonna be going on. So we'll simulate we're raising the bed. Okay, Mr. Boney, we're going to go ahead and get started. Is that okay? Okay. So I have the door shut for your privacy, so you're going to be kind of exposed. But don't worry, okay? It's the door shut. So we're going to roll down his blankets. And we're going to turn Mr. Boney on his side here so we can do his wound. Okay? And as you can see here, Mr. Boney has multiple wounds, ranging from a stage 4 pressure ulcer to some deep tissue injuries, or some skin tears I should say, some DTIs, some stage 3s. He also has an anal fissure, okay, and then he also has a surgical site incision right here on the right lateral part of his thigh. So this is the wound care that we're going to be providing today. Okay, so we're just going to assume that he's laying in this position so we have access to the wound here. Okay, so the first thing we want to do is you want to set up your Chuck's pad underneath the wound and the leg as to keep the area and the bed as clean as possible. Okay, come have a look at this incision, please. So the first thing we want to document is the size and the depth, and that's if it was not pre-recorded. So in this case, we're just going to kind of document the size. So the length is going to be approximately 5 inches. Okay. And then what we can do, we can measure the depth with one of our cotton tip applicators. Okay, so it's about 5 inches in length, and at its peak, the width is about an inch wide. So what we're going to do by adding packing to the wound is we're going to promote healing from the inside out. Okay. Turn that over. Okay, so the first thing we're going to do is we're going to come in and we're going to inspect the area to see how it looks. Go ahead and just pan in on here, please. As you can see, whoever packed this the last time did not do an adequate job of packing it sufficiently. This should have been packed a lot more and maybe use a packing material more so than just a 2x2 gauze. In this case, I'd use an inch packing strip, which I did not bring with me for this tutorial, so we will be using 2x2 gauzes to make sure the entire situation is covered here. Okay, so the first thing we're going to be doing, depending on if it was really dry, we can pre-moisten the area with some saline. So we're just going to pre-moisten the old gauze so it comes out a little easier. Okay, you might need scissors. You might need gauze, you might need forceps to get some of these out. In this case, they should be able to pull right out. Okay, so what we're going to do is with the old gauze, we're just going to go ahead and start to peel it out. Okay, we're starting the procedure now, Mr. Boney. Okay, you're going to feel a little discomfort. You let me know if it's okay and if you need any medications. Okay, so we're going to take out the old packing material. Okay. We're going to have a look at the wound to see how it's looking. Okay, so we're going to say it's looking nice and beefy red. Looks like it's healing. You can see where the sutures were removed and it might have eviscerated. So now we're going to promote healing from the inside out. Okay. With one of these cotton tip applicators, this is how we're going to measure the depth. So we're just going to put it in at its deepest area. You also want to check to see if there's any tunneling within the wound to see if the cotton tip applicator can dump anywhere. Obviously it does not. So in this case, there's no tunneling. It's just a straight wound. So at its deepest point, it is about an 1.25 inches deep. So the wound is 5 inches long by an inch wide and an 1.25 inches deep. Those are some of the documentations we are going to be doing upon documenting our wound. After we've established all the old dressings out, we're going to get ready to do the new dressing. My hands have gotten dirty from the old dressing, and this is when I'm going to take off my first pair of gloves. Okay, and now we have some clean gloves to handle our new packing material. So we're going to get our Metapore tape. We are going to get our gauze. Where the wound is at, we can get it approximated with some Metapore tape so we won't need the net underwear. Our saline, because it's a wet to dry dressing with saline. And it doesn't look like the wound has any redness around the edges or nothing new that's starting, so we won't have to document any new changes of redness. Okay, so what we're going to do now is go ahead and open up our 2x2s. Okay. And we're going to moisten them up with some saline. And this is just sodium chloride, 0.9%. We could squeeze out any excess. And let's see if we can get this in sufficiently here. So we're going to get our other cotton tip applicator. And we are going to start from the outside, making sure you get all the edges. As I said, I would have probably used 1-inch new gauze for this type of wound. I think it can really pack the entire wound a lot better than these 2x2 gauze. Unfortunately, I don't have any to show, but that's probably the best bet in this scenario. So we're going to continue to pack and making sure you get every aspect of the wound. You want it all the way to the surface. Are you okay, Mr. Boney? You doing okay? You feeling some discomfort? Okay. So as you can see, the wound is still not 100% approximated. We should close it up some more. Unfortunately, I did not bring enough saline, so we're going to have to make do with now a 4x4 gauze here. Probably could have used that in the first place. We're going to saturate that with saline again as well. We're going to kind of roll it up now because this is the top surface. We might be able to get away with covering it up this way. Okay. And it's important to document exactly what you used and how many you used. So right now we have a total of 6 2x2s, because you got to remember the 2x2s in a pack come in a pack of 2. So we have 6 2x2s in there along with 1 4x4 dressing. You want to make sure you get all the edges, get it nice and closed. So this is the best way to promote healing here. There's a little bit of a gap here. I think like I said, if I had the 1-inch packing material, I could have covered this entire surface. But for this scenario, I think this suffices. Okay. Once we have the wound 100% covered, we're going to cover it with a dry dressing. And we will close it with some Metapore. An abdominal pad would have been a lot better in this scenario, because if the wound was very vascular and had a lot of oozing, abdominal pad is the best thing to absorb that excess fluid. In this case, once again, all I had available was some 4x4s. So we are going to close the wound with some 4x4s, cover the wound I should say, and then we are going to approximate all of that with some Metapore. Metapore is the best because it's super stretchy and it's easy to get off, and it's repliable. So we're going to go ahead and start at one edge, making sure there's the least amount of creases as possible. And as I said, Metapore is stretchy, so you can bring it over the wound. Stretch it to get all this excess. You want the least amount of crinkles. We don't want to add more pressure ulcers here, or skin tears, or any other ailments here to Mr. Boney. He's already got a pretty sick little body going on here. Okay. So, once we have the wound covered, we can get our marking pen. All of this is going to be considered dirty now. And we can document the wound, dressing change, and the time. So I'm going to put my initials, today, which is the 21st, and the time. The time is now 12:05. Okay. After we've done that, we can get everything that's within this area. It is now considered contaminated, so we can just keep the Chuck's pad and use that as a way to put in all of our dirty supplies here. Okay, we're going to throw this in our proper waste receptacle. Okay, and then we're going to get Mr. Boney back into a comfortable position. Okay, Mr. Boney, I'm going to get you back on your side, okay? Would you like to be covered, Mr. Boney? Yes? Okay. How are you feeling? Are you in any pain? Are you okay right now? Okay, well here's the call light. If you need anything, make sure you call me right away, okay? Okay, thank you. So after we've done our wound care and are ready to exit our patient's room, we want to make sure everything's in the patient is where it's supposed to be. He's in bed, the rail is up, he has the call light, there's no IVs leaking or anything. Just give your patient a quick glance, and then we're going to go wash our hands. As I said before, make sure you wash your hands thoroughly, 20 seconds minimum. You could sing the happy birthday song 2 times, and that should give you a sufficient hand washing duration. Make sure you give yourself a real good lather. And then we're going to go back to the nursing station and document the wound care that we just provided to Mr. Boney. So as I said, the wound was 5 centimeters in length, 1 1/4 centimeters deep, and it was 1 inch at its widest point. We packed it with 2x2s times 6, 1 4x4, and it was closed with 4x4 dressings and Metapor. The wound was beefy red, well approximated, no new oozing or discharge noted. Looked like it was healing. We'd also document with the wound care the WBC count, because a WBC is a good marker of an infection. So as everything I just said, we'd be documenting in our nursing notes for the day in regards to the wound care. We would also say the time that we provided the wound care, how the patient tolerated the wound care, and if any medications were given prior to the wound care. So we would do more of a pie type of note, where you had the problem, you had an intervention, and then the evaluation would include how the patient tolerated the WBCs, etc., etc. Okay? Now once that's all documented, okay, let me just make sure it's all documented here. Make sure there's no new orders. We're all caught up on our orders. All meds have been given. Mr. Boney's taken care of. So now what we'd be doing is going to check on Mr. Jackson. You can't forget about Mr. Jackson. We got to make sure Mr. Jackson got his bed bath by the CNA. So let's go ask the CNA if he gave Mr. Jackson a bed bath. Mark is one of our CNAs here. Mark, did you give Mr. Jackson a bed bath?
Yes.
Are you lying?
No, sir.
You gave him a bed bath?
Yes, sir.
Did you clean the scrotal area?
Yes, sir.
Okay, I know you like that, so thank you. Okay, and that's pretty much it. That concludes our tutorial on how to provide wound care. In this instance, it's regarding surgical site infections. And remember, anytime we do any type of wound packing, it's to promote healing from the inside and up. Okay? I hope you like this tutorial, and hopefully there'll be many more to come.